So, hey everyone, welcome back to my YouTube channel. I hope all of you are doing well. So, as you can see on my screen, what is our today's topic? Yes, which is mistake every nursing student makes. So, without wasting any time, let's get into the topic. Let's see what are we digging today and what are we learning today. Let's go for it. Okay, so as you can see on my screen, what are the mistakes that almost every nursing student do make? So we'll be talking about this today. So you also at some point of time, whether in your clinicals or at your classroom, might come across all these mistakes or basically you used to make these mistakes at one or the other point of time in your life. So these are not asking doubts, being afraid in clinical postings, ignoring basic concepts, and poor communication with the patient. So this communication part we've already discussed in the last video. So yeah, okay. So before just landing onto the topic, I wanted to share some kind of imaginary story to you. So though it is an imaginary story, I have also experienced this in my life, and you also would have come across this. And if you're just a first year nursing student, you will obviously. So what the story is? So let's suppose you enter a ward and let's say it's the first to the second week of your clinical posting and you came across a patient and that patient asks you, ma'am, what is this medicine for? What is the action of this medicine and when to take this medicine? What is the dose and all that stuff. But as you are a fresher, as you stepped into first or second week of your nursing clinical practice, you might not sure about the actually about the mechanism of the drug or about the particular use of the drug. So you might feel confused. Also, at the other hand, you feel it a little bit difficult to go and ask your senior because you might feel at the time that you are being judged and you even don't know the basic mechanism of action or basic class of this drug. So you might feel hesitant to do that also. So what you used to do sometimes, you used to give like a vague answer to the patient and you used to come out from that situation. But when you come back, what will happen is there is this fight will start inside your brain. At one time, you will be thinking that I should have gone to my senior, I should have asked, or you might be thinking that why my basics are not clear, why am I not knowing that what is the effect of this drug, or what is the class of this drug, or what is the use of this drug. So, you put yourself in sort of dilemma. So, this happens with many of us on sometimes on daily basis. This might be happening when we are not studying properly, when we are not clearing our core concepts properly, and sometimes it happens in. So as you know, the pharmacology you used to study in second year, but there are a few basic drugs which we need to know in first year itself. So I'm talking about the drug which is some sort of basic drug. So if you don't know about that also, it might land up you into a dilemma. So what is the solution to it? The only solution to it is you going back, or at that particular point of time, you should ask your senior. You should take help. You should take advice. And while you go back to your hostel or to your home, you should study about that. You should never leave that topic as such that okay, she would have or the patient would have asked me this. No problem. I was not doing that time, but it's okay. It's not exam I'm going to. No, you should come back, you should, discuss about that topic with your friends, discuss about that drug with your friend. You should clear you should clear your doubts then and there itself. So what happens sometimes, students don't feel very much confident to, stand up in the class and ask doubts from the teachers. That is, I think, most silly thing a student can do. Never do that. Ask as much as questions as you can because, you are a student and at the stage you are gaining knowledge. So if you're not asking doubts means you are taking a back seat somewhere when it comes to gain knowledge. So that's very wrong. Do ask as much as questions as you can. And it is teacher's responsibility to give answer to each and every question of yours. So, even if one day you might feel like, oh my God, what do you think that I even don't know this also? Doesn't matter. It does not really matter in classroom because you are at a place where you actually are learning. So, go for it, ask as many questions as you can, and don't be afraid of being afraid in clinical posting. क्लिनिकल पोस्टिंग में आप तब तक ही डर सकते हो जब तक आपकी नॉलेज में कुछ कम जब आपके नॉलेज में कुछ कमी नहीं है ना नो नीड टू बी अफ्रेड ऑफ एनीथिंग यस ignoring basic concepts nothing में बहुत important है try to go going into detail is also very important but don't land up directly into the detail of any particular topic without clearing the basics बेसिक से स्टार्ट करो हर एक चीज को स्टेप बाय स्टेप करो एंड बेसिक आपके जितने क्लियर होंगे उतना ही का जो आपको डिटेल में कुछ पढ़ना है वो भी उतनी इजीली ही आप ग्रैब कर पाओ पोअर कम्युनिकेशन विद द पेशेंट पेशेंट का कम्युनिकेशन इंप्रूव करना इज वेरी वेरी इंपॉर्टेंट ये तो मैं आपको पिछली वीडियो में भी बोला था सो ट्राई टू कम्युनिकेट एज मच एज यू कैन विद द पेशेंट ये भी एक चीज है विच विल हेल्प टू इम्प्रूव योर कम्युनिकेशन स्किल्स कई बार लैंग्वेज बैरियर भी हो सकता है sometimes patient is not comfortable in the language which you know and sometimes you might not be comfortable in the language of patient uh, try to communicate in language in which both of you might even both of you will be able to communicate from both the ends. So try to communicate in that language. So yeah, please work on your skill and don't stop asking doubts because that is the only thing which will clear all your confusion and which will help you to gain knowledge. So I hope you understand that what is the main motive behind making today's video lecture. When I specifically talk about asking doubts, I'm also saying that while I'll be posting the upcoming lecture videos, you have to ask me doubts so that I love students who do ask doubts, and I was as a student used to ask a lot of doubts. So just also सकते हैं पूछिए. Teachers are there to clear your doubts. So yeah, all the very best, and thank you very much.